One.
Okay, Jonathan Oye. Today is June 19th, 2015. I'm going to be testing cranial nerves 1 through 12. Starting with cranial nerve 1, I'm going to have the patient cover up one nostril with their fingertip and take a deep breath in. Okay, cover the other nostril and take a deep breath in. Okay, a little congested on the right side. Okay, I want you to close your eyes and cover one nostril. And I want you to take a deep breath in. Okay, breathe out. Okay, cover the other nostril, take a deep breath in. Okay, and what was the scent?
Coffee.
Okay, was the intensity same on both sides?
Yes.
Okay, awesome. Okay, now we're going to test cranial nerve 2, the peripheral aspect of cranial nerve 2. Okay, I want you to look straight ahead. I want you to look at the corner of this TV right here.
Okay.
Okay, I want you to cover one. Oh, actually, I want you to look right here, midline.
Okay.
I want you to cover one eye for me. Okay, and I want you to tell me if you see 1, 2, or 3.
1, 2, 3, 2, 1, 5, 2,
Okay, I want you to cover the other eye. Okay,
1, 1, 2, 5, 5, 2, 5.
okay. Now I want you to, now we do the fundoscopic exam. I want you to look straight ahead at the corner of the TV right here.
Okay.
Okay. And I will be checking for papilledema, hemorrhaging, and AV nicking, which I do not see any of. Okay. Now I'm going to assess the other eye. Assessing for the same 3 things on this eye as well, which I do not see any of. Okay. Next exam, I'm going to test cranial nerve 2 and 3. I'm going to start off with pupillary fatigue. Have the patient look straight ahead, and I will be shining a light in your eye. Look straight ahead, the corner of the TV right here for me, and I want you to keep your eyes on that. So we're checking for pupillary fatigue. I'm looking for the pupils to constrict, which they do. Okay, and I'm going to check the other eye. And I'm checking for the pupils to constrict and hold, and if they were not to, it would show cranial nerve 3 fatigue. Okay. Next, I'm going to do direct and central for testing cranial nerve 2 and 3. Okay, I'm going to have the patient look straight ahead at the corner of the TV. Okay, and as I shine the light in their eye, I want to see both pupils constrict. Which both pupils do constrict. If the pupil on the opposite side where it was not to constrict, it would be a motor loss. And if the pupil were not to constrict on the side where I'm shining the light, it would be a sensory loss. Next, I'm going to test cranial nerve 3. Okay, I'm going to have the patient look straight ahead, the corner of the TV for me. I'm checking for ptosis, which I do not see in either eye. Okay. Next, I'm going to have the patient close their eyes and checking for blepharospasms, which I do not see any of. And next, I'm going to have the patient open up their eye, stay looking at the corner of the TV, and I'm going to have you look directly at my finger, and I want you to follow it. I'm going to test for accommodation. Okay, follow it. And both eyes do converge on my finger, which means cranial nerve 3 is properly functioning. Next, I'm going to assess cranial nerve 3, 4, and 6, and I'm going to have the patient look forward at me, and I want you to keep your eyes on my finger, and do not turn your head, but I want you to follow it. I'm going to check the patient's field of gaze. So first I'm going to perform the H in space, so I want you to follow my finger without moving your head. Patient adequately follows my finger. Next, I'm going to do a X in space. I want you to follow my finger without moving your head. Don't move your head. Okay, and I want want you to follow this finger too as well without moving your head. Okay. Patient's cranial nerves 3, 4, and 6 are functioning properly. Next, I'm going to assess cranial nerve 5 for sensory and motor. This is going to be a bilateral test. First, I'm going to test bilateral pain, but first I'm going to ask the patient, what do you feel right here?
Prickly.
Prickly? Awesome. Okay, I'm going to perform this test bilateral on your cranial nerve 5. So I want you to tell me if you feel the intensity is the same on both sides. The intensity is the same on both sides?
Mm-hmm.
Okay. Intensity the same on both sides?
Mm-hmm.
Intensity the same on both sides? Awesome. We're testing cranial nerve 5, V1, V2, and V3 aspect. Now I'm going to test light touch. Okay? Do you feel this?
Yes.
Okay? And I'm going to do the same thing as I did before. I want you to tell me the intensity is the same on both sides.
Mm-hmm. Mm-hmm. Mm-hmm.
Okay? Now I'm going to test bilateral motor function of cranial nerve 5. I want you to clench down with your teeth. Okay? And I'm assessing the muscles of mastication. Okay, awesome. Both of them are contracting properly. And now I'm going to have you open your jaw. Okay. Next, I'm going to assess cranial nerve 7, motor aspect of cranial nerve 7. I'm going to have the patient seated, looking straight ahead, and I'm going to have them raise their eyebrows, close their eyes, smile. Dallas Cowboys going to win the Super Bowl. All right. And then puff out your cheeks. Okay. Next, I'm going to assess cranial nerve 8. Okay, patient, you're going to look straight ahead. Okay? And I want you, do you hear this?
Mm-hmm.
Okay? What about this?
Mm-hmm.
Okay, is intensity the same on both sides?
Yes.
Okay, close your eyes. And I want you to tell me which side you hear my fingers rubbing on.
The left. Right. Right. Left.
Okay, awesome. There is no problem with cranial nerve 8. But if there was, we would perform a Weber's and Rene test. Weber's test, we would sound the tuning fork and put it in midline on the occiput. And whichever side the sound would lateralize to, we perform the Rene's test on that side. Perform the test on that side, putting the tuning fork behind the mastoid process, testing bone conduction, and we put it there until they can hear anymore. And then next we would test air conduction in front of the patient's ear. And if the air conduction is louder, AC would be greater than BC, therefore it would be a sensorineural deficit on the opposite side. But if BC was greater than AC, it would be a bone conduction deficit on the same side where the sound lateralized to. Okay, next I'm going to have the patient look straight ahead, and I'm going to stand looking away from the patient, checking for resting nystagmus, which they do not have. And next, I'm going to have the patient stand up, and I want you to stand right here with hands to your side, eyes open, and I want you to walk heel to toe towards me. Assessing the patient's tandem gait, which is good. Next, I'm going to have the patient come back, close their eyes, hands at the side, and I'm going to stand on the side of the patient so they don't fall, and I want you to walk heel to toe for me. Okay? The patient kind of sways to the left, so it may be a cerebellar dysfunction on the left side. Okay? Can you open your eyes? Okay, I want you to sit down. We'll assess cranial nerve 12. Okay? We're going to look at the tongue, so open your mouth. Checking for atrophy or fasciculations, which I do not see. And if the tongue would deviate to one side, meaning the lesion would be on that side, and they would have atrophy on that side as well. Also, we're going to have you push your tongue out to the left side against my hand. Okay? Okay, which they both are strong, so we don't have any cranial nerve 12 lesion. Next, I'm going to assess cranial nerve 9 and 10. I want you to open your mouth, and I want you to say ah,
Ah.
ah,
Ah.
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 Okay, and the soft palate elevates, so there's no problem with cranial nerve 9 or 10. And I'm going to gag you right now, so open your mouth.
Oh.
Okay, one more time. Okay, cranial nerve 9 and 10 are working properly, and the last test will be cranial nerve 11. The accessory nerve, so I want you to push up on both of my hands. Okay, trap's working properly. I want you to turn your head to the right. Okay, turn your head to the left. Okay, and the SCMs are properly functioning. and that is the cranial nerve 1 through 12 test.